Now, in the health sector, the World Health Organization says efforts to halt an outbreak of the deadly Ebola virus in the Democratic Republic of Congo seems to be working, but substantial risks remain. The outbreak has so far killed 77 people in North Kivu and Ituri provinces among 116 cases. 15 of the cases were health workers. Media officer of the World Health Organization, Tarek Jasarevich, joins us now via Skype from Geneva. Hello, Mr. Jasarevich.
Yes, I can hear you.
Okay, very well then. Substantial progress has been made with the efforts to curb the outbreak of the deadly Ebola in the Congo Democratic Republic. We hear that there are substantial risks that remain. What are these risks? We'd like to know.
Well, you are absolutely right. There has been good progress being made in the past month since the outbreak has been declared. We have all pillars of the response in place. We are identifying new cases. We are following those at risk. We are vaccinating people who need to be vaccinated, who are eligible to receive the vaccine. And we also started with providing new drugs for those who are infected. So on top of a vaccine that was a new tool we had at our disposal in the last outbreak in DRC, now we are also starting to administer new drugs. Already 24 people receive these new treatments. So we are doing some progress and we see some promising signs. But as you have said, there are still some risks in this outbreak that we have to count on. People are sometimes coming with delay to treatment center. Some people are still not understanding disease very well. There's also a security concern that it's still there, although it did not hamper response so far. We cannot rule out the possibility of getting cases in the areas that are very hard to reach. So this all means that we need to continue our fight, and next couple of weeks will be really crucial to see if we manage to contain.
And this is not the first time the Ebola virus is breaking out in DR Congo, but what factors would you say necessitated the latest resurgence?
Well, first you have to understand how people get infected with Ebola virus. So virus is being harbored within animal world with a specific species of a bat. Now this bat is living all over vast forest areas in DR Congo. So we can't really eradicate Ebola virus as we can with those circulating only in humans. So necessarily there will be people infected with Ebola simply because there is a contact between animal world and humans. What we can do, on the other hand, is to be ready to quickly detect and respond to these outbreaks. This is the first time that this particular area in DR Congo in North Kivu has seen the outbreak. And again, we have to start from the beginning of explaining to the population what Ebola is and what they need to do. But again, as I said, we have tools at our disposal. WHO has sent in more than 180 people only in this first month, and we are doing everything we can to support Ministry of Health together with other partners to have all those pillars of response in place.
All right, well, the WHO, quite frankly, has made tremendous progress, and we're very happy with that. And as you rightly mentioned, some risks have been identified, but beyond the risks identified, what measures have now been put in place to ensure that these risks are substantially reduced, if not completely eliminated?
Well, we have, and I'm just coming back from Beni. I spent last week in Beni, in Mangina, that's the epicenter of the outbreak. So what I have seen is really that we have teams, not only from WHO, but from partner organizations such as UNICEF, International Federation of Red Cross, Médecins Sans Frontières, Alima, and we should also mention UN mission in Congo. We are all there to support Ministry of Health to put those pillars. And those pillars are basically epidemiological work, trying to understand where virus may have gone, contact tracing, trying then to reach out to these people who are at risk, who may have been infected with a person who tested positive. These people are then followed for 21 days. There is also a program of safe burials. So community deaths are dealt in a way that there is no amplification of the disease through burial practices. Now we have free laboratories, one in Goma, one in Mangina, and one in Beni, to quickly test people who are suspect for Ebola virus. We have teams doing surveillance work and outreach to the community, which is really important that people understand what they should be doing. And people do not always understand, because this is the first time this particular population has seen the virus, and it's a normal emotional response to a loss of a loved one, that people do not necessarily accept interventions that are proposed. So we really need to go deep into community, work with the leaders, with the religious leaders, with the civil authority, with community leaders, trying really to spread this message through direct contact, through using of radio stations, and really trying to get everywhere and try to understand to people what happens once a person who is sick with Ebola goes to treatment center, what happens next. So we are really trying to make that link. Once a person who is sick is in the treatment center, that community knows what's happening there. And obviously the existence of vaccine and these new drugs that I just talked about is a really big shift, because it offers hope. So now when people see responders, they also know that there is some hope, and not only that someone is coming to take your loved one and then you don't know what will happen with it next.
All right, thank you so much, Media Officer of the World Health Organization, Tarik Jasarevic. Thank you so much for joining us on TVC News Hour.